GMA Health Alert on diabetes, including new data from the CDC showing that an estimated 1 in 3 kids between the ages of 12 and 17 have prediabetes. ABC News medical correspondent Dr. Darien Sutton is right here to help us break this all down. And as a family, I grew up in a family with so much diabetes. This is terrifying. This is really terrifying.
It is.
So what are the findings and really what is prediabetes?
I'm so glad that you asked that, because so many patients have a diagnosis of prediabetes and don't know. So prediabetes is essentially a warning sign that your body is having difficulty managing sugar. And the reason why it's important to know about that is because there's no symptoms often. It is often silent. It has to be tested for. And the warning is that if you get that diagnosis, your risk of developing diabetes increases by up to 30% within 5 years and 70% within your lifetime. And this new data shows us that this diagnosis is now considered common among teens and adolescents. This new data and analysis from the CDC shows that 1 in 3 adolescents, as you said, between the ages of 12 and 17 have a diagnosis of prediabetes, a rate that has more than doubled since the year 2000. And separately, for adults, we've seen the rate of new diagnosis of diabetes stop decreasing after more than a decade of decline. And to give you some context into how important this is, diabetes is so much more than a problem with sugar. It damages blood vessels, increasing the risk of heart disease and stroke, which are the leading causes of death within the United States.
Yeah, it's so dangerous. When you're talking about prediabetes in teens, is treatment different than with adults?
Well, treatment is very much the same, but the key here is prevention. Prediabetes is more than just a diagnosis, it's an opportunity, but many parents don't know how to test for it. So the American Academy of Pediatrics, as well as the American Diabetes Association, has recommendations on who to screen, and you start with the highest at risk. And there are some caveats here to understand, because for many it may not be obvious. So number one, if your teen is overweight or obese, that is the leading risk factor. If they have additional risk factors, at least a family history of diabetes, signs of insulin resistance that can include high blood pressure or high cholesterol, or if their mother had diabetes during pregnancy, if one or more of those risk factors, that teen should be screened, and that involves a blood test. We look at a test called an A1C. It looks to see how much sugar is bound in your blood. You want a number below 5.7%. The higher the percent, the more the risk.
We have about 30 seconds, but I just want to ask you, how should families prevent this? What do they do?
Yeah, well, start by knowing the numbers, talking to your provider, getting a basic routine exam, and then screening from there. And I think it's really important when you're talking about weight with teens that you emphasize on lifestyle changes and not diet trends. It can be very difficult during that period of life. And the recommendations for activity are a lot more than you would think. For teens and adolescents, it's recommended at least 60 minutes of physical activity a day. Now, it doesn't have to be running. That can simply be walking, but making sure you're mindful of your diet, mindful of sugar consumption, and again, teaching ways to live a long, healthy life instead of just short adjustments.
Such important information. Dr. Darien Sutton, as always, thank you so much. Malik?
I love that reframe about making sure that you see this as an opportunity. Dr. Sutton, we really appreciate it.